It's one of the gadgets that keeps Courtney McLaren out of danger. A small pod under her shirt delivers the right amount of insulin, which her body doesn't produce on its own.
You're coming down.
For type 1 diabetics like Courtney, regularly monitoring blood sugars ensures she doesn't get too much or too little insulin, which could have fatal consequences. But insulin delivery devices, glucose monitors, test strips, and all the connected supplies add up each month.
It was shocking when I added it up this morning, kind of sickening because, between 800, let's say 860 as a conservative figure, that's a mortgage payment in New Glasgow, or that's a couple car payments.
Provincial insurance coverage has its limits, and it's often different for each province. Same with private insurance. Insulin pumps alone can cost as much as $9,000, leaving some people to ration or raise money.
There's something very, very wrong when you actually have to go out and fundraise for one of these amazing devices to manage blood sugar, thus not being such a drain on the healthcare system.
Those were the days.
When Paul Levine was diagnosed with type 1 diabetes, most people didn't live past their 60s. Levine is 72, healthy, and a mentor to newly diagnosed young people.
A lot of them, don't have jobs where there is insurance coverage, and they see it as a real burden.
Add to that the worry about rising prices. In the last 4 years in the U.S., the cost of insulin has doubled. And even with the promise of pharmacare, diabetic devices and supplies still won't be covered.
To leave people to private markets and healthcare is a difficult thing to do because they really have no control and no ability to control the prices.
For now, Tammy McLaren says her family is managing the cost of Courtney's diabetes, but unless the system changes, her daughter will one day have to manage on her own. Vic Adopia, CBC News, Toronto.